They say words don't leave bruises. But neuroscience disagrees. Because the brain does not measure pain by what is visible. It measures pain by threat. And when a child grows up hearing constant criticism, "Why are you like this? You'll never be good enough. You're too sensitive. You always mess things up." The brain doesn't interpret those as opinions. It interprets them as danger. At first, criticism feels like disappointment. Then it feels like shame. Then it becomes identity. And that's where the real damage begins. Because repeated verbal criticism doesn't just hurt feelings. It rewires perception. Research in developmental psychology shows that chronic verbal aggression activates the same neural pathways as physical threat. The amygdala, the brain's alarm system, becomes hypersensitive. Over time, it stops asking, "Is this unsafe?" and starts assuming, "It probably is." That changes everything. When someone is constantly criticized, especially in childhood, their brain learns to scan for mistakes before they even happen. This is not insecurity. It's conditioning. The prefrontal cortex, responsible for reasoning and decision-making, begins to operate under pressure from an overactive stress response. That means decisions feel heavier. Memory becomes less reliable. Confidence feels fragile. Because cortisol, the stress hormone, interferes with memory consolidation and cognitive clarity. You might forget simple things. You might second-guess obvious choices. You might rehearse conversations over and over in your mind. Not because you're incapable, because your nervous system never learned safety. Verbal abuse often hides in plain sight. It doesn't always look like screaming. Sometimes it looks like sarcasm, dismissal, mockery disguised as humor, constant comparison, or affection that disappears the moment you make a mistake. And when criticism becomes constant, the brain adapts in two common ways: hypervigilance or emotional shutdown. Hypervigilance looks like overthinking every word you say, reading between lines that might not exist, preparing explanations before anyone asks. Emotional shutdown looks like detachment, numbness, not reacting, even when something hurts. Both are trauma responses, and many people don't recognize them as such. Long-term exposure to criticism can contribute to symptoms similar to complex PTSD. Not because there was one dramatic event, but because there were thousands of small cuts. Complex trauma isn't about intensity. It's about repetition. And repeated criticism creates a nervous system that expects humiliation, even in safe rooms. That's why survivors of verbal abuse often struggle in relationships. They assume love is conditional. They wait for the real opinion to appear. They distrust compliments. They feel uncomfortable being seen, because being seen once meant being evaluated. Criticism reshapes self-talk. Over time, the external critic becomes internal. The voice that once came from someone else begins speaking from within. You're not good enough. You're too much. You'll fail. Don't try. This internal critic feels logical, responsible, protective, but it's not wisdom. It's adaptation. The brain learned that anticipating criticism reduced shock. So now it criticizes first. That's how trauma from verbal abuse shapes behavior without people realizing it. Memory is also affected. Studies on stress and hippocampal functioning show that chronic stress can reduce clarity and recall and impair emotional regulation. This is why some survivors struggle to trust their own memories. They question whether events were that bad. They minimize their experience, or they replay specific phrases for years. The brain holds onto criticism more tightly than praise. Because threat sticks, safety fades faster. Decision-making also changes. If you were criticized for every mistake, mistakes no longer feel like learning opportunities. They feel like proof. Proof that the criticism was right. So you hesitate. You delay. You overanalyze. You choose what feels safest, not what feels aligned. And safety becomes defined as least likely to be judged. That's how toxic relationship patterns continue. Because what feels familiar feels predictable. And predictability feels like safety, even when it hurts. But here is something important. The brain is not fixed. Neuroplasticity does not disappear with trauma. Healing does not mean forgetting. It means retraining. Nervous system healing begins with one core shift: learning to differentiate present from past. When someone offers feedback, your body might react as if you're 10 years old again. The goal is not to eliminate that reaction instantly. The goal is to pause long enough to say, "This is now, not then." Breathing techniques that extend the exhale calm the vagus nerve. Grounding exercises reconnect the body to the present moment. Therapy modalities like EMDR and trauma-informed CBT help reprocess critical memories so they no longer trigger survival responses. And slowly, the brain learns something new. Not every voice is dangerous. Not every mistake equals rejection. Not every opinion defines identity. Rebuilding confidence after verbal abuse isn't about positive affirmations. It's about evidence. Small, repeated experiences of safety. Setting boundaries without apology. Saying, "That comment doesn't feel okay." Leaving conversations that feel degrading. Surrounding yourself with people who correct you without humiliating you. Who guide without shaming. Who disagree without attacking your worth. Boundaries are not aggression. They are nervous system protection. And guilt after setting boundaries is often leftover conditioning, not wrongdoing. If you grew up constantly criticized, your sensitivity is not weakness. It's calibration. Your brain learned to detect subtle changes in tone, expression, posture. You became perceptive, observant, aware. That skill is not the problem. The belief that you are fundamentally flawed is. And that belief can be unlearned. Slowly, patiently, through repetition of safety. Healing from verbal abuse does not mean you will never feel triggered again. It means triggers no longer control your identity. It means criticism becomes information, not verdict. It means you can evaluate feedback without collapsing into shame. And that process takes time, because the nervous system does not change through logic. It changes through experience. Repeated, calm, corrective experience. If you recognize yourself in this, know this. Your difficulty trusting yourself is not proof of incompetence. It is proof of conditioning. Your hesitation is not weakness. It is a survival strategy that once kept you safe. But survival is not the same as living. And you are allowed to move beyond survival. You are allowed to develop a voice that isn't harsh. You are allowed to build relationships that don't require shrinking. You are allowed to make mistakes without feeling erased. Verbal abuse leaves no scars that cameras can capture. But the nervous system remembers. And memory does not mean permanence. It means history. And history can be integrated. Not erased. Integrated. Because the brain that adapted to survive criticism is also capable of adapting to safety. Slowly, intentionally, and without guilt. If this video felt familiar, take your time with it. Healing is not dramatic. It is repetitive. It is quiet. It is practiced. And it is possible. You are not broken. You were shaped. And shaping can continue.